I'm going to present a study from the National Diabetes Register in Sweden. It's an observational study on insulin pump treatment and about hard endpoints, mortality in cardiovascular disease and total mortality are the endpoints. I will just quickly go through this study. Just a few words about the registry. It's a quality registry, internet-based. It started in 1996. And today we have all the hospital clinics in the registry, almost all of the primary care as well, and more than 95% of all known patients with type 1 diabetes are recorded. This is the number of or proportion of adult patients with type 1 diabetes that have insulin pump. We see that 1 of every 4 women, adult women, have pump today in Sweden, and somewhat less in men. And totally 1 of every 5 have pump. And in children it's much more common. More than half of the children have pump. And they will not let go of it when they grow up. And the aim of this study was to look into those treated with insulin pump and compare to those treated with pen as for mortality and cardiovascular diseases. So the study is based on the registry, and we have cross-linked to the cause of death registry, the inpatient registry, and Statistics Sweden for income and education level and so on. And we have studied a little more than 18,000 patients with type 1 diabetes. Of them, there were 2,441 with pump throughout the whole study period, and they were compared to 15,727 patients that had injection during the whole study period. We have used a propensity score to be able to balance these two groups and to be able to compare them. They were included during 2005 to 2007, and they were followed to an endpoint or end of follow-up at 2012 for almost 7 years. You might say it's a short study, but it is as good as it gets today. This is a busy slide. It's just there are differences between people with pump and without, and the persons with pen, they are slightly older. They have slightly longer diabetes duration, they have the same A1C, they have higher blood pressure, they have more previous cardiovascular disease, somewhat lower educational level. So there are differences between the groups. And we use this propensity score to be able to balance these two groups, and then we can compare. It's like to try to have a situation like controlled randomized study. You may know about this method. And these are the data. This is just crude survival curves, and you see that survival is high. This is a rather young person. Pump in blue and red is injection. And if we change the y-axis, you see this a little bit better. Still, the absolute numbers are low. But you see there are differences throughout the study period between pump and injection. The survival is higher in the pump group. This is unadjusted. If we look at it when we have adjusted for all these covariates that we know of, and you see here the number of events. We could take fatal and non-fatal coronary heart disease. 6.7% have an event of that in the injection group compared to 4% in the insulin pump group. And you see the numbers here for the other endpoints. Very nice. These are the main results in red. Quite dramatic results, I would say. As for fatal cardiovascular disease, the hazard ratio is 0.56. and for total mortality 0.71, so 30% less risk if you are treated with pump as per total mortality. And you see it a bit better this way graphically. So very strong result for fatal and total mortality in this study. So we conclude that in this observational study, you have to remember that, patients treated with pump may have benefits with lower risk of fatal cardiovascular disease and all-cause mortality compared with pen injections. Thank you.